Hello, I thought I'd give a bit of an update on my hip resurfacing recovery. It is now day 12, so it's the 18th of July. I had my surgery on the 6th of July, and generally I'm feeling amazing, way ahead of where I thought I was going to be at this time. When I compare how I'm recovering with my resurfacing versus my arthroscopy, it's just night and day in favour of the resurfacing. I was in agony for months after I had my keyhole surgery on my hip. This time I'm already miles ahead of that. So feeling really positive so far. Still doing minimal activity, still using crutches, as I have to do so for the first around 6 weeks, and still relying heavily on my wife to look after me, but doing more and more for myself each day and becoming a bit less of a burden, hopefully. So a few things I wanted to talk through. So first was pain levels. As I said, for my arthroscopy, I was just in a lot of pain. I guess they were repairing damaged tissues, and it just took a while for that damaged tissue to recover in an area that doesn't get much blood flow. This time round, well, I guess I've just whipped it all out and replaced it with some metal, so pain has been a lot less than I anticipated. I guess I would say right at the beginning of the surgery, it was obviously sore, but I took a lot of drugs and painkillers to mitigate that. The very first day, and one thing I didn't cover in my previous videos, I don't think, was in the hospital the first time I tried to move after my surgery with help from the nurse. So I was lying in a bed, kind of upright, but the nurse had asked me to shimmy over to the edge of the bed, and I couldn't fathom in my brain moving a millimetre. It'd been quite a few hours since I'd moved, maybe 6 hours or so, and my legs had been completely numbed. So, I just had no feeling in my legs initially, but then once that was taken away, I obviously had the surgery pain and all of the drugs, plus whatever stiffness I had from lying in the same position for hours and hours and hours. It was literally one of the hardest things I've ever done, to move from one side of the bed to the other. And at the very beginning, it just felt like an immovable object. That was the very first time, but it just got easier and easier. Very quickly my blood flowed back into my legs, and I was able to move quite freely again, and that felt good. And that just improved over the first few days. It was obviously quite sore, particularly driving home, and then moving after driving home, getting in and out of the car. But yeah, I'd say for the first 5 days, I was pretty sore, and on the fifth day, for reasons I'll just go into, I was in agony on the fifth day morning, and didn't think I was going to be able to get out of bed. I found it difficult to move centimetres, but then took some painkillers, and then I was fine an hour later, and got out of bed and got up and actually felt fine after that. And now on day 12, I'm feeling I wouldn't say I'm getting any sharp pains at all. I have a bit of a throb in my leg, which I would describe as a dull ache, which I'm guessing people who require hip resurfacing are probably used to anyway. But pain levels way below what I expected. My scar, my wound on my right leg feels a little bit tight, which I guess it is because it's been opened and then sealed back together again. So that does feel a little bit tight, but yeah, no, I wouldn't say it was painful, not even to the touch. I still have my dressing on, but I'm getting that off in a few days, and my staples removed. In terms of painkillers, right now I'm on very minimal painkillers, due to the risk of deep vein thrombosis. I've been prescribed, moving to mitigate that, but also I was on injections. So I had to inject my stomach, or my wife injected my stomach for the first week, and now I'm on aspirin. So I take a dose of aspirin a day, and I've been taking some paracetamol, and that's kind of it. I'm not really big into painkillers. I'd prefer to, not take drugs unless I really, really need to. Which takes me on to the next point I was going to raise, which was last weekend. So when I came back from my surgery, I took a couple of days to get settled and really work out hour by hour drug routine, and what doses I should take and when, because they say you should take 3 or 4 tablets a day. They don't tell you the specific hours to take it, and they don't tell you when you're going to be asleep, and obviously. So eventually, a couple of days later, we worked out what we thought was the right routine for taking pills. And at that time, I was on paracetamol, codeine, and nefapam. And it took me a couple of days to realise that just wasn't doing me any favours at all. The codeine in particular was just completely wiping me out. I felt nauseous, I felt groggy and horrible. So I spoke with the pharmacy in the hospital and said to them I'd prefer not to take the codeine. They said that was fine as long as the pain was manageable. And so I just stopped taking the codeine. So I was just going with nefapam and the paracetamol. And it took me a couple of days to start feeling human again, because I just wasn't eating or drinking as much, and I was finding it really difficult to find the motivation to get up and move, just because every time I did, my head was fuzzy and I just felt horrible. So I think that was more related to the drugs than the surgery, and perhaps I have an intolerance for codeine. Maybe wouldn't make a very good heroin addict, as it's an opiate. So I seem to have sorted that, and I think 2 or 3 days later, I started to feel human again and was back to eating and drinking and basically recovering as I was hoping to do. The last piece of the puzzle, and kind of general well-being, has been sleeping. So I was really struggling to sleep for the first week. I think I spoke about that in previous videos. Partly that was due to probably some throbbing pain, not necessarily intense sharp pain, but just dull aches. And partly it was due to just not being able to move. So lying on my back as a side sleeper is not an optimal idea for me. So I was having to, every time I felt uncomfortable, I was waking up, and I was finding I was getting an hour and a half, 2 hours at a time, and then I'm finding it really difficult to go back to sleep. So there's probably a lot of factors involved in that. But thankfully, the last couple of nights, I have slept for around about 7 or 8 hours, with a few wake ups, but mostly that's just to go to the toilet because I've been trying to drink lots, and yeah, but finding I'm able to go back to sleep quite quickly. I feel I am probably quite tired, and that's just as expected. I really expected the first month from this surgery to be a complete write-off, and just for me to be finding it difficult to get out of bed and be in pain and be horrible and be grumpy and tired and sleepy. Probably still grumpy, but just remarkably well ahead of where I expected to be. I would say I'm still trying to take it easy, so I'm not going overboard. I'm just just still taking it easy, not trying to push it too much. I have been given some physio exercises. Some of those exercises, I mean, it's all very basic stuff, but some of it's more advanced than I would have expected at this stage. So a hip bridge being a good example of that. So, the classic bridge routine, lying on the floor, digging your heels in the ground and squeezing your glutes. So I've been doing that. Again, the physio has advised me to do that. That doesn't necessarily mean everyone should be at this stage. So yeah, a few other examples like that. So feeling pretty positive. I'm able to do a lot more movement than I was. So I think I spoke about wasn't able to get out of bed myself in a previous video. I can now get in and out of bed pretty easily without crutches. But then I use the crutches to move from the bed. Getting in and out of chairs a breeze. Getting up and down stairs is a breeze. So yeah, so that's all good. Feeling really positive, and really one of the things I've been occupying myself with is just thinking about what I can do now that I couldn't do, and starting to think about what kind of plans I can actually make that I couldn't make before. One of those plans is I've always wanted to go to the Alps and climb Mont Blanc. So I've been to the Alps numerous times and done a lot of running around there, and always fancied climbing Mont Blanc. Never quite got around to it last time, but I think probably will do in the next 12 to 18 months, assuming recovery continues on this trajectory. But anyway, I've waffled enough, so I will stop for now. Thank you.